Good morning. Today we are going to discuss about important and interesting topic as eating disorder. A food plays an important role in our life and it has a good relationships among ourselves. We always used to think about what to cook and what to eat. This is going to be have a changes in our life. These changes which create a lot of problem in our health. If you feel very happy, you may eat too much of foods. If you very sad, you are not going to have food properly. This will bring eating habits, changes in the eating habits, which will be abnormal in our human being. If you are having irregular eating habits without having the balanced diet for a longer period of time, which create an serious health issues. These health issues which will be happening for a longer period that may lead to death also. Eating disorder, it is an actual serious illness that causes severe disturbance in the person's eating behavior. It describes illness that is characterized by irregular eating habits and severe distress and concern about the body weight or body shapes. As per ICD-10 classification, F50 to 59, it is created as behavioral syndrome associated with psychological disturbance and physical factors. F15, eating disorder. F15.0, anorexia nervosa. F50.1, atypical anorexia nervosa. F50.2, bulimia nervosa. F50.3, atypical bulimia nervosa. F50.4, overeating associated with psychological disturbance. F50.5, vomiting associated with other psychological disturbance. F50.8, other eating disorder. F50.9, eating disorder unspecified. Now we move on to the types of eating disorder. It has classified into two major types. One is anorexia nervosa, bulimia nervosa. Under anorexia nervosa, binge eating, restrictive types. Under bulimia nervosa, purging, non-purging type. Anorexia nervosa, it is an eating disorder characterized by weight loss. Here they are having the consciousness about overweight, weight gaining, body shaming like that. It leads to lack of appropriate weight gain and growth in the childhood. It is difficult to maintain appropriate body weight as per height, age and structure. In many individuals we will be having these disturbances. The people with anorexia nervosa, they will be restricted number of calories and the food based on their bodies and body shaming. Some people will be have excessive compulsive about purging by vomiting as well as laxative or else binge eating type. So the incident here, it is most common in female comparing to male, commonly which will belongs to adolescent age group from 13 to 19 years. In India, 0.2 to 10 lakh population is affected with eating disorder. Approximately 5 in 10 girls attaining puberty who is having this incident. Etiological factors. Here we are having the two etiological categories. One is environmental and one is biological. As per environmental factors, the media culture playing the major role because they will be having the serious ideal stereotypical informations about constant about the body fitness, and based on the profession and career promotion they have to maintain the weight or else weight loss. And next one is the family and childhood trauma, the child who is having the abuses, trauma. And next one is peer pressure. So here the co-workers and peer friends who is criticizing about the body weight and body shaming. This will create an conscious toward the anorexia nervosa. Biological factors. The person who is having the irregular hormonal functions, especially for thyroid as well as your other hormones. Next one is genetical factors. Heredity plays an important role and we can't able to find out what is the exact part, but it playing an important role. And nutritional deficiency. Due to the concern about the body weight and weight increases, we will be having the loss of foods that may create a nutritional deficiency. The signs and symptoms of eating disorders: extremely restricting about the eating. So here they will be stop about thinking of eating. It leads to extreme thinness, emaciation, and losing of weight. So they will be going for underweight, and they can't able to maintain the normal weight, and this will be created a lot of body image disturbances. So here this will be having the lack of self confidence, which is going to have lower body weight. So thinning of the skin and thinning of the bone, which may leads to arthropenia and osteoporosis, and it leads to mania. It leads to mild anemia, muscle wasting, weakness, dryness, wrinkled skin. That will be having the growth of fine hair all over the body, severe constipation, alter in body vitals like your blood pressures, slowing of breath, pulse, damage to the structural and functions of the heart, brain damages, dropping of internal body temperatures, lethargy, sludging, feeling tired, infertility. The complication associated to anorexia nervosa: first one is amenorrhea, fatigue, lack of energy, skin problem, dizziness, headache, dryness, dehydration, shortness of breath, irregular heartbeat, cold hand and feet. Hair loss, stomach pain, edema, loss of bone mass, depression, insomnia, cardiac arrest, death. So the management here, the medical management. So we want to focus about priority about the anorexia nervosa, addressing about serious health issues which may result to malnutrition and it leads to lethal conditions. The drugs like chlorpromazine, antidepressants like fluoxetine, amitriptyline, these drugs which will use for medical treatment, and we have to plan for restoring of the lost weight. For that, menu plan is created, and we want to teach about the education regarding the normal eating pattern and importance of nutrition in the health. The therapy. So here we have focused about behavioral therapy, individual psychotherapy, family therapy, group therapy. So those therapy which will associated with these eating disorders, which will address and heal the traumatic event and coping them regarding the eating habits. Now we move on to bulimia nervosa. It is an psychological and severe life-threatening eating disorders which is associated to ingestions and abnormal large amount of food feeds in the short duration of period, which may lead to attempting of avoiding of weight gain. For that, they will be having the purging, which was consumed the food. So the causes which is have exact causes of the bulimia nervosa is currently unknown. The history of abuses, trauma, stress and negative body image, poor self-esteem, a professional and activity which is focused about the appearance and performance. And next thing is continuous constant weight fluctuations, electrolyte imbalances which will be having the vital parameter changes like your cardiac arrhythmias, cardiac arrest, which will create a lot of problem in our health. And last one is broken about the blood vessels within the eyes, enlarged about the glands in the necks and under the jaws line, oral traumas such as lacerations, thinning about the mouth. Next one is chronic dehydrations, inflammation about the esophagus, chronic gastric refluxes, eating in a large amount of quality, lack of control over eating and switching between the periods of overeating or else fastings, fluctuation will be happening, frequent usage of bathroom after the meals and having smell of vomiting. The complication: fatigue, lack of energy, amenorrhea, skin problem, dizziness, headache, dehydration, shortness of breath, irregular heartbeat, cold hand and feet. Hair loss, stomach pain, edema, loss of bone mass, depression, insomnia, cardiac arrest, and death. The management, here we are using tricyclic antidepressant, carbamazepine, lithium. Along with that, nutritional counseling is essential. We have to focus about the foundation of nutrition and essential about the nutrition, which will create an impact on proper nutrition. And along with that, we have to focus regarding the behavior therapy, individual psychotherapy, family therapy, group therapy. So by this we come to the conclusion. So food plays an important role in our life, as well as food plays an major traumatic changes in the health and health aspects. Thank you.